Hi there, my name's Taylor,
My name's Jessica.
and I'm here to talk to you today about kids physio, physiotherapy, and autism.
So the goals for today, introductions, understand what we do here at Kids Physio Group, discuss the benefits of physiotherapy for individuals with developmental disabilities, including autism,
Discuss how we collaborate with other professionals, as well as tell you about how we make physio fun. Again, I'm Taylor. I'm a private pediatric physio with Kids Physio Group. I'm a RASP certified physio, meaning a registered autism service provider here in BC. I've previously worked as a behavior interventionist and support worker with the Canucks Autism Network, volunteer snowboard instructor with Vancouver Adaptive Snow Sports, and I enjoy working with kids and families to help them break down barriers to participation in their lives.
Hi, I'm Jessica. I'm another private pediatric physio at Kids Physio Group. I am RASP certified. I've been a pediatric physio for 12 years, working with children in early intervention, school age, and neurodevelopmental clinic, and now in private practice. I work with children of all ages and love helping children and their families meet all their goals.
So Kids Physio Group, lots of P's here, private practice pediatric physio. We're clinics across Canada, and we work to make kids physio accessible and fun. We have 16 clinics in total, and there's 8 in BC, 6 in the Lower Mainland, another one in Kelowna and Victoria. And our mission is to provide the care needed for all kids to reach their absolute maximum physical potential and 100% recover from injury.
So what can pediatric PT offer? We'll jump in, and will be a brief overview before we delve into the specifics of physio for kids with autism. We support children from 0 to 18 years of age with any physical goals, such as infants and toddlers, children and teens, those with physical and developmental delays, those with autism, or those who need of pelvic health physio. Other pediatric physios may have different ages or populations, so if you're not in an area where there's a kids physio or you're choosing to see someone else, please check and see. The importance of physical literacy. We are working with kids, not tiny adults, so kids have different needs. We always talk about kids learning to read and write or learn math, etc., but learning to be physically literate is just as important. Physical literacy is essentially the ability to move with competence in a variety of physical activities. Being physically literate includes things like knowing and understanding how to move, having the competence and confidence to do so, and being able to do it in a variety of settings and with different goals and demands. In BC, this is an integral part of the PE curriculum.
So how can we help individuals with physical and or developmental disabilities? Okay, so first, just a note about language here. Even though we use the term disability, we know that our community is very able, and we serve individuals with conditions that you may see here, such as cerebral palsy, muscular dystrophy, autism spectrum disorder. I'm not going to read the whole list, but you can go through what we might see in the clinic. Yeah, we're very inclusive and open to seeing and learning a lot from our community. And we believe that the children with the conditions listed, again, are very able, and we're excited to support them in reaching their maximum physical potential. What can we support with? So things that we do at Physio include supporting challenges with gross and fine motor skills. So these are terms embodying gross motor skills being generally using your larger muscle groups, fine motor skills using your smaller muscle groups, so like your fingers and using your hands, for example. Ambulation, fancy word for walking, and equipment support, tone and spasticity management, working on range of motions, flexibility and postural control, post-surgical rehabilitation, neurological impairment and recovery, as well as long-term rehabilitation. And what does physio look like? So for those of you who've been to an adult physio clinic, our clinic looks very different. We include lots of play. We try to make it fun because it can be very intimidating when you are going into a new space, a new environment, and meeting new people. So if we can have all these little icebreakers and these things to make our community feel comfortable and confident, then it makes it a little bit easier for them. So we address limitations to movement through play. So we're trained to assess how we're moving, how our kids are moving through interacting with these toys and games that we have. We have a mixture of some hands-on therapy as well as some hands-on stuff too. Examples for hands-on is Cuevas medic exercises, hands-off being motor relearning types of therapy. Limited modalities, this is getting at how, again, at an adult clinic, you might see a lot of things such as electrical stimulation, things that machines you would add on. There's not as much research for the pediatric population, and it can be a little bit intimidating too. So we have limited modalities in our clinics. We have some specialized equipment such as a harness for treadmill assisted walking, reformer, Pilates machine, and swings. We use a lot for vestibular. Long-term goal setting, so we like to sit down, take a really good, call it subjective history, get to know who's coming in, what their goals are, and help them achieve those goals.
So how can we help kids with autism? As you already know, we see kids of all ages and for a variety of reasons. So why specifically would we recommend physio for kids with autism? Well, to be honest, physio is not going to be right for every child with autism, and I'm not suggesting that all of them be referred. For some kids, physio can be of a huge benefit. There are some specific statistics for kids with autism, such as 51% may have hypertonia or low muscle tone. 34% will have motor planning challenges, and 19% will toe walk. These things can have an effect on multiple areas of development and are tied to many other physical components, such as difficulty with gait or walking patterns, functions and activities of daily living, and confidence in sports and just an active lifestyle, to name a few. Here is a summary of what we're going to continue talking about on some of the upcoming slides. Things like low muscle tone, we can see challenges with gross motor skills, balance, coordination. Things with sensory differences, we may see challenges with motor planning, toe walking, body awareness, etc. So weakness and hypotonia. What is low muscle tone or hypotonia? They're two similar concepts, but they're actually very different. Low muscle tone and weakness often go hand in hand, but specifically hypotonia is the amount of tension in the muscle at rest, whereas weakness is decreased muscular strength. Features of this may include lack of joint stability, decreased muscular strength, decreased balance, decreased core stability, or limited propulsion, so difficulty pushing off when kids are running, difficulty when they're jumping. An example of muscle tone is something like thinking of a hairband. So when it has really high tone, you may barely be able to stretch it. When it has really low tone, you may have to wrap it around your wrist or your hair like 5 or 6 times before it'll do its job and hold your hair in place. In that perfect circumstance, you would only have to wrap it around 2 or 3 times. There are many other ways to think about low tone, but it doesn't mean that the muscles can't work. It just means that they need a little bit more to get to the same point. In terms of hypotonia and autism, what does this mean for you and what might you see? Some of those signs of weakness or hypotonia may include difficulty with tummy time when they were a baby and keeping their head up in extension. When they're sitting now, a slouch posture or a posterior pelvic tilt, like that child in the picture is seeing, where their hips are tipped backwards, their shoulders are very rounded. Propped up, if they may be propped up on their arms when they're sitting on the floor or always holding their head in their hands. W sitting, as shown in the other picture. You may also see things like hypermobile joints and having their knees or elbows locked into extension. We may also see low activity tolerance, so that means that they might get tired with an activity quickly, or they might get tired especially if they're learning a new skill. Poor attention and motivation for learning new skills or learning skills that require more energy. Frequent tripping or falling, and then difficulty stopping or staying in one position.
So motor planning. we use motor planning for all physical activities, and it's an important part of coordination. If you just think of the word, motor refers to using your muscles, planning refers to planning, kind of organizing what you're going to do with your muscles or what activity you're going to do. And there's varying numbers of those with autism who have difficulties with motor planning and coordination. So this is something that we work on a lot. So this can include everyday tasks such as brushing your teeth, washing your hands, walking up the stairs. And difficulties also can include remembering, performing the steps needed to make a movement happen, issues with timing or sequencing movements, as well as a decreased understanding of the task or the activity. So what might you see, or what might that look like? Signs of motor planning difficulties may include clumsiness, particularly with walking or transitional movements. So, for example, catching our toes or having more falls. Having difficulties with activities that involve multiple steps. So jumping jacks, for example, might be a little bit more challenging. Difficulty with ball skills, particularly catching. So being able to coordinate with your eyes and your hands, being able to catch, being able to throw. Difficulty tying shoes, forgetting parts of an activity. An example here being struggling to place your foot on the rung of a ladder when climbing down, but just kind of climbing down with your hands.
So toe walking, another point that we might see with kids with autism. Toe walking is a very specific walking pattern where there is no heel strike when the foot first meets the ground. It can be considered a movement disorder with poor foot positioning and alignment. Treatment is strongly recommended when kids are up on their toes more than 50% of the time, when they're losing ankle range of motion, when they're lacking some functional skills like the ability to perform a jump, a deep squat with heel contact, when they have poor control during activities, and oftentimes this looks like preferring to move through activities really quickly or losing their balance when they're staying still, or just avoiding tasks because they're too demanding energy-wise, or they can't maintain them and have their heels off the ground. The longer the child uses a toe walking pattern, the more challenging it is to treat. Early intervention is key when addressing toe walking, and the watch and wait method is not recommended. It is important to note that during the toddler years, toe walking is actually one of the normal gross motor skills, is that they be able to reach up on their toes to get something from a counter, that they be able to stand on their toes and balance, that they be able to walk in a line on their toes. And that's why we have some of those recommendations, such as if they're walking on their toes more than a specific amount of time. Because while we do expect that toddlers are going to experiment with it, we don't expect that it maintain the primary way of walking. What you might see for prolonged toe walking, it can lead to several long-term complications if it's not treated. Things such as acquired equinus foot deformities, and that's just saying that you'll lose the range of motion and the toes will stay pointed. Knee instability, footwear incompatibilities, increased frequency of injury, joint pain, arthritis, and impaired function or decreased participation. We will also talk later in the presentation about how toe walking may relate to pelvic health. Proprioception. Proprioception is something that we don't have specific statistics for, and the number of kids with decreased proprioception. And that's primarily because proprioception is a combination of many different things. It has been suggested that proprioception difficulties may contribute towards decreased motor planning, decreased postural control, etc. But proprioception in and of itself is our body's awareness of its location in space and has an effect on balance in all of our positions. Children with gross motor delay often have decreased body awareness, and proprioceptive difficulties are often associated with hypertonia and hypermobility. What signs of proprioceptive difficulties might include an increased laxity in joints in weight-bearing and non-weight-bearing positions. So that might mean they are hypermobile and we're seeing hyperextension in different positions, excessive compensatory movements with balance activities. So that might look like flailing to the side, leaning, doing different things with their feet during those positions. Clumsiness, frequent tripping, falling, or bumping into things because they don't know where their body is in space. Trying to maintain as much contact with the floor or surface as possible. So we do have those kids who might be gravitationally insecure, not want to go up onto the swings or the slides or onto the playground structures. And we may also see a lot of jumping and crashing for those kids who have proprioceptive challenges, because doing those activities helps give the joints and body the information that it needs to know where it is in space. So what does physio for kids with autism look like? Well, PT goals will vary greatly dependent on the child, their current level of skills, as well as their goals. In general, PT goals may include things like muscle strengthening, stretching and range of motion, gait mechanics, balance, motor planning, ball skills, functional tasks, recommendations for physical activity in the community, sensory integration. It can even include things like increased confidence in moving around in their environment, decreasing tripping and falling. Really, we work with the child and their family to determine what goals would be the most appropriate for them. We aim to work with all disciplines and therapies a child might be seeing to collaborate and use similar strategies during our appointment.
So pediatric pelvic health, how can we help? Some areas addressed are daytime or nighttime bladder or bowel incontinence, chronic constipation or withholding, giggle, urge, and stress incontinence, pelvic floor dyssynergia, increased or decreased urinary frequency, and pain in the perineal or rectal region. So we have physios who are specifically trained in pelvic health who can help address these areas. And what an assessment might include is a history taking, so asking questions, getting some more information, such as relevant past medical history. How did the potty training go, for example? Discuss sensory discomfort about going to the bathroom, and discussing where this child is right now and with their motivation for toileting. And how we can help with pediatric pelvic health. So bowel and bladder education and tracking, recommending dietary changes, pelvic floor exercises, core exercise, and interoception training.
So some special considerations for pelvic health as it's related to autism. Gastrointestinal issues are huge driving forces between pelvic floor dysfunction. We know that kids with autism more often have gastrointestinal issues. Things like constipation means a lot of pressure in the bowel, and that can press forward and put increased pressure on the bladder. Kids who withhold their pee or poop get better and better at withholding until the urge to urinate or defecate goes away completely. Musculoskeletal considerations, not necessarily specific to autistic kids, but those in general that we see with delays. Things like low tone leads to dysfunction of the tummy muscles, back muscles, pelvic floor muscles, diaphragmatic muscles. Kids who are toe walkers often have constant or intermittent tightness in their pelvis and therefore have a tougher time relaxing on the toilet. Toe walkers specifically, because they're so extension driven, meaning they're up on their toes, their whole body's into that extension position, often can't relax into a deep squat where our pelvic floor muscles are relaxed. Therefore, they tend to have an increased resting tone in that pelvic floor, which can increase that pelvic floor dysfunction. Physio can work together with BIs and or OTs to create strategies to support toileting goals for families. We're super happy and super keen to collaborate. So what to expect during a physio session? The following slides will go over what to expect during an assessment or a follow-up session. In reality, this is a rather rudimentary view of what might actually occur. In actuality, so much more occurs during the initial assessment or follow-up sessions than can be written out on paper. At Kids Physio Group, the initial assessments are generally 1 hour in length, and this is fairly common across many physio clinics, not just our own. If you're finding, for whatever reason, that you think your child is going to need more time to warm up, or might need to come in early to see the space so that the session is successful, we can always make accommodations. A physio will get your and your child's consent to continue with the session, explain what physio is, explain what the plan for the day is or the assessment is, and get your child's pertinent medical history and what brings you into the session, into the clinic today. During an assessment, a physio may make assessment items into an obstacle course to encourage specific movement patterns. They may set up the room prior to your arrival, or they may set up exercise stations and play stations. If physio is recommended, the therapist will work with your family to set physical goals and then provide you with a treatment plan.
So in this obstacle course, Jess is working on her core stability, completing a plank walkout here, throwing the sticky ball to work on some coordination. She's going to test her balance through the balance beam, stepping over the little frogs, working to our little shark friends, or shark markers, hopping on one foot, then 2 feet jumps over the giant buildings to make it all the way through the obstacle course.
If physio is recommended after an initial assessment, our physios will work with your family to determine the frequency of recommended follow-up. There's not a one plan fits all families. We work with you and what your child needs to determine what would be the best. Most often, follow-up sessions are 45 minutes, though this can be modified depending on the needs of your child. A follow-up session often looks more like play than the assessment, since the physio will have a better understanding of what your child needs, and the games will be more directed to what your specific goals are. Our therapists know how to use a wide range of treatment techniques to create fun, effective, and functional therapy sessions. So what to expect for collaboration? We are often willing to write a quick summary of an assessment to your family doctor, pediatrician, or specialist. We often connect with other team members, your OTs, BIs, speech therapists via email, Zoom, phone. We can also connect with family members, sports teams, daycares, whatever is needed. We can incorporate techniques used by your family or other team members into our sessions to help them achieve their goals, and to use similar language or strategies as other people are already using. And we collaborate a lot with you. You know your child best. So we often use you as part of the experts in what might be motivating for them.
So now, what to expect if your child needs sensory regulation strategies, communication strategies, emotional regulation strategies, low demand activities. So we know that there are a lot of barriers for autistic kids when it comes to participating in physio. We do our best to reduce those barriers at our clinic, and that's because physio can be hard sometimes. Again, there can be new challenges, new people, new interactions, and we try to get our bodies to do things that are new and hard. So we want to make it as easy as possible by having these strategies available for our kids. We don't want our kids to have to deal with an environment that is difficult to focus in and having difficulty communicating your needs and wants within our sessions. Our physios are great at accommodating so kids who need changes in the sensory environment can feel comfortable and calm. We can also use self-regulation strategies to help your child attend activities in a regulated emotional state. We use a lot of different communication strategies and tools at the clinic. And most importantly, we know that you know your child best, and we'll always ask what you and your child's goals are for physio and how we can best support you and your child in achieving those goals. So sensory seeking or sensory avoiding, we make adaptations in our clinic to best suit your child's needs. Some examples of sensory seeking equipment would be sensory tiles or sensory stones here. So these have little dimples on them for our kiddos who require a bit more sensory input to their feet, and we use them such as or in things such as obstacle courses or in home exercise programs that you can work on in the clinic to make it a bit more fun. We also have some swings. This one here is a lycra swing, so a stretchy material that we hang up and have for some of our kids who Some kids really like to spin, some kids like that feeling of deep pressure that kind of brings them into kind of like a fetal position. We have a slide in our clinic too that I'm not going to pass through me here. Some examples of sensory avoiding things would be turning off or turning down the music if we're listening to it within our session. Quieting the clinic time, so moving to a space that might be a bit more quiet. And then also dimming the lights for some who might be kind of overstimulated with the bright lights. Next, for communication, we have a number of tools that we use to assist with communication, such as a communication board. We have a whole list of activities, and we may use this for a child who wants to tell us what they want to use or complete in our sessions today. We have a board, first them board or choice boards. This one, for example, would include 2 activities that we're going to begin with and what we're going to work towards. First, bowling, then racetrack. Sounds like fun. Making sure we use clear, concise, and simple language. Using sign language for some of our kiddos. And having our child use their augmentative and alternative communication, such as iPads. And adapting to ultimately what works best for your child. We want to help them achieve their goals, and we don't want communication to be a barrier, so we have these things to make it easier to communicate and to ultimately work towards their goals. Emotional regulation. So we will collaborate with you and your child and their team, whether that's their occupational therapist or speech language pathologist, behavior interventionist, to get to know your child, to get to know when to use what strategy, and to get to know which strategies work for your child in the moment of dysregulation. Demand avoidance or difficulty following directions. So we adapt our environment for what works for your child. We'll set up our environment to be engaging without giving overt instructions. We'll let the child choose the schedule or activities for the day, or at least parts of it. And the session may be child-led, especially early on when we're trying to get an idea of what your child may be interested in, trying to get them more comfortable in the environment. So we kind of follow their lead and make changes to work on what our goals are.
So why physio? Lots of autistic kids could benefit from physiotherapy in many ways, however, not all need it. There may be other therapies or activities that are more important for your family or child than physio is right now. It's important to think about what you and your child's priorities and goals are when it comes to therapy. You only have so much time in your week for things like PT, OT, speech, play, and doing all of the therapies can be time-consuming and exhausting for the whole family. Think about what is most important and what goals are most important to you. If you aren't sure if your physio needs need to be prioritized, it's always worth it to chat with one of us and we can work it out together to figure that out.
So benefits in BC. Funding and benefits that can be used for physio include AFU, or Autism Funding Unit, AHP, the at-home program, RAS, so that's Registered Autism Service Providers. So these certified therapists, they're currently located at all of our locations in BC, and there's a website where you can identify who is certified for the RAS list, is what it's called. And it's a list of professionals who have the experience in education to offer programs for children with autism. If the child is under 6 and you want to use autism funding to pay for services, you need to choose service providers specifically who are on the RAS list. So you can find on this RAS provider website, as well as we're working to have that on our website too. And physiotherapists can also help support families when applying for funding grants, such as through Variety, the Children's Charity, and CKNW. And another note, just not on the slide, is you can also use your private extended health insurance too to cover physio. What to look for if you may need to come in for an assessment for physio. You may see toe walking at home with your child. You may see frequent falls, kind of tripping, catching over their toes or their feet. Delayed gross motor skills, again, gross motor skills being the large muscle groups, so the big movements like jumping, things like running, things like balancing. Not keeping up with peers, sometimes it's hard to know if the gross motor skills are delayed. So sometimes when you're in a group setting or in a community where there's other children of similar age and you're noticing maybe they're behind or maybe they're not doing what other kids are, that could be a reason to check in and see how their gross motor skills are. Having difficulty with any sports, whether that's the inclusion piece, just being with the other people, whether that's more of the movement piece and not having the skills, we can kind of look and see what strategies might help your child be included in that sport and participate with the other children. Poor confidence. So sometimes we don't have as much opportunity, or we have some more barriers or challenges to movement. So having a space where we can recreate some of these situations and work on balance and jumping and running can help boost our confidence and help with going into sports, for example, or just playing at the playground and being more active overall. And hypermobility, so having a bit more flexibility, or low tone, so that being having it be a little bit more challenging to use our muscles and work on strength, is another reason that we can come to physio or get an assessment.
Thank you for watching our presentation. Be sure to check us out in BC. Taylor and I are working at the East Van Clinic on Fraser Street. We also have clinics in Richmond, another one in Vancouver specifically at City Square, Surrey, north and south, North Vancouver, Victoria, Kelowna. You can find us across Canada as well.
Our website is kidsphysio.ca. Our Instagram is @kidsphysio. You can reach Jessica and myself personally at jessica@kidsphysio or taylor@kidsphysio.ca. Thank you for listening to our presentation, and we hope to see you again soon.
Thank you. Hope to see you soon.